Hello, I'm Ganesh. In this video, I will be demonstrating how to use this tool to visualize drug prescription adherence data. Let me first give a brief introduction on the data we are trying to visualize. When a patient is prescribed a drug, let's say for 90 days, and the patient was supposed to refill the drug once it's over, that is, after 90 days. If you look at the data, the patient was prescribed from January 7th to April 7th, but they refilled it even before it was over. So there is an overlap. On the other hand, it was supposed to get over on June 21st and they refilled it on 10th July. So there is a gap. So, more the gap, less adherent the patients are. We are trying to visualize adherence pattern in a large dataset of drug prescriptions. Link to this tool is at the end of the video. Let us see how to use this tool. The tool has three sections. On the left, it has filtering options. On the center, where all the graphs are, and on the right, it's a data group, which I'm going to show you in a while. Let me explain you each graph before we start using the tool. The first graph shows medication possession rate, that is MPR, versus number of patients. MPR is the ratio of the number of days the drug is available to the patient to the total medication period. And the second graph shows the number of patients versus total medication lifetime. And this graph shows the medication possession rate versus subgroup of patients. It's a normalized rank of their MPR values. This graph shows medication possession rate versus months from medication start date. The size of the graph shows the number of patients. As you can see, the number of patients decrease over the time. And also, their adherence pattern changes over the time. And then, while this graph shows MPR versus medication lifetime in a scatter plot. Each dot corresponds to a patient. It's a ratio of MPR value to the number of days they were under medication. This graph shows the distribution of gaps versus number of patients. The same way, this graph shows the distribution of overlap between number of patients and the total number of overlaps during that medication period. Okay, so now using this tool, we can analyze different drugs based on their gender, based on age, or you can compare and contrast a low MPR versus high MPR, or how adherence changes based on the number of days they are under medication, etc. When I click on drug analysis, it shows the distribution of drug and the adherence data, and also shows the strength of each drug. If I want to analyze only two drugs, I can just toggle between drugs. If you notice here, there are more number of people on drug 3 between 0 on 45 days compared to the number of people on drug 3 between 720 and 760 days. And also, if you notice here, those who are on drug 3 have lower rate of MPR compared to other drugs over time. Now, if I wanted to do gender analysis based on gender, how adherence varies, it seems that almost the same between male and female. Though there are some variations, it's more or less the same. Now, if you compare those who have low MPR value versus high MPR value, those who have low adherence rate, they actually are between 130 days to 720 days. It shows that everybody were adherent to the prescription in first 3 months. And also, if you notice here, all the patients seem to have low adherence rate during third month, but Those who have higher overall MPR, they tend to pick up and then it goes higher, whereas it goes lower and lower by 8th month. So this kind of information can be visualized using this tool. Another feature this tool provides is to apply filters. Data smoothing filters can be applied on this graph to find new insights. For example, let's set 10 days of gap and overlap threshold. So it is basically removes 10 days of gap between two medication period. And if you noticed, the graphs changed. MPR 30 is MPR calculated for every 30 days of the medication period. Apart from MPR, there are a few more other measures that can be explored using this tool. Like we want to find the distribution of population based on the number of days of gap, the distribution of gaps corresponding to those patients who have less than zero point 0.7 MPR. So let's select them and then go down to the chart where it shows the distribution of gaps. If you compare these two graphs, there is more gap than overlap, zero overlaps and more number of gaps. This is among the people who have less adherence. Apart from these, other measures like continuous single interval medication availability or continuous multiple interval medication gaps are the other ones which you can explore using this tool. Thanks for watching.